Yeah, hi Sowmya, welcome to the Big Unlock podcast. It is a pleasure to have you here. So
Thank,
I, yeah, so
thank you very
welcome.
much, Maha. Thank you very much, Rohit.
Appreciate it, that you are able to spare time for this. So Soumya, we would like to start with some quick introductions. So I'm Rohit Mahajan. I'm the CEO and managing partner at Big and Demo Consulting. And we've been doing this podcast for a while, so it's pretty popular with our listeners. So I'm sure they're looking forward to understanding your thought process and what advice you have for them. So could you please start with your introduction as well?
Absolutely. Thank you so much for giving me this opportunity to chat with you. I'm Dr. Sowmya Viswanathan. I'm the Chief Physician Executive at BayCare Health System, which is based out of Tampa, Florida. And we have a fairly large health system here with 16 hospitals and more than 180 care center locations, including a very large employed physician group. I also have a very strong physician partnership, which is our network of physicians. So we have almost 1,000 physicians and allied health professionals in our network, and we also have huge foray of physician partners with network of more than 4,000 physicians in our network in this area. Spans a very wide geographic reach, all the way from the Gulf Coast in what we call Clearwater, which is Pinellas County. We have 12 counties in our pocket, and we go all the way to Winter Haven, which is almost touching Orlando. So we
Ah,
have a very wide geographic reach, and north south also. We go from what we call the Pasco County down to Manatee, which is a very wide region to cover a lot of ground with hospitals, physician group, multi-specialty group practices, health hub locations. We have ambulatory surgery centers. We have urgent care centers, and you name it, virtual care, everything that goes in it. Prior to coming here, I've been here 2 years plus. Prior to coming here, I was in Massachusetts for the most part of my healthcare career. I'm an internal medicine physician.
great.
I did my residency training in Boston University.
Awesome.
And subsequent to that, I was at all the academic health systems there for the most part. I was at UMass for a few years and with the Partners Healthcare System, the Harvard School System, which is Partners. I was there for a few years. Then I was at Dartmouth Hitchcock, and I did a brief stint with Tenet Health before I came to BayCare. I also got, in addition to my medical degree, I supported myself with a double master's with an MBA as well as a master's in healthcare management. So I think tried to round up my personality before I took on the leadership role at BayCare.
That's amazing. So a couple of curious questions, because you mentioned this transition from Massachusetts to your new role over there, and also that you are a practicing physician, and then you took on, this additional, uh, skills, from a leadership perspective. So what motivated you, Soumya, into this direction? That is my one of my questions. And second is, what are the differences that you find between the two? Let's say geographies or the roles that you've had here previously in Massachusetts and now what you're doing over there.
Absolutely. So I heavy hitter on the clinical side. I love clinical. My patients loved me, the typical clinician. But I started getting roles and opportunities to take on projects on the management side or so-called the leadership side. When I took the projects on, I felt very comfortable when I was doing them. And I started getting more projects because as you deliver on the outcomes and the results for each of the projects, people say, oh, she's done this, so let's give her
Yeah.
more. So it ended up being that I was first, I raised my hand for projects and then I just started getting them. And I had some really good mentors, and the mentors trusted me, which is also important. So I circled back to them and said, I like doing this, but I'm not sure. Do I want to give up clinical or not? So that was the time when I decided to do MBA and MHCM just to make sure that I do want to go down this path of leadership. And it turned out that I started liking it a lot. I liked it as much as I liked clinical. So it came to a point where I couldn't do both equally well if I spent 100% of my time on both of them. So it's 200% of my time. So I had to carve out and figure out which direction I wanted to go in. And finally, once I did my MHCM, I realized I really like leadership and I want to give it my best, put my best foot forward and give it my best shot and see how well I do. And that's what led me to taking on leadership role. And BayCare has been pivotal because the health system is on a tremendous growth mode. We are expanding like crazy. So what also helped us in that journey is a lot of the health systems in north, I should say, all the northern states, through COVID, they allow their people to work remotely.
Yeah.
And as you may have seen in the news, a lot of people gravitated or they moved, migrated down to southern states for warm weather and they could work remotely.
Yeah.
So the fastest growing cities ended up being, at that time, it was Austin, Texas, and Tampa, Florida.
Wow.
So the population here has grown so much that the system, and BayCare is the largest health system in the West Central Florida. So, and it is rated as one of the best in quality outcomes, patient safety. People provide clinically excellent care. So it became imperative that, we are on a growth mode. We need to support the population that has migrated here. And I jokingly say when people move down and migrate to other areas, they don't bring their doctors with them.
Yeah.
So we had to support, we need more doctors here. And
Yeah.
that's what helped me make the decision to make this my stop where I can contribute to leadership team and administration. Big differences that I see is, um, at least in BayCare, I should say that BayCare has traditionally come together as a health system with the acquisition of community hospitals, and then we set up a medical group to move forward in expansion of the medical group. So there hasn't been a lot of focus on academics, which is heavy in Massachusetts, as you know.
Yes.
So for me, that was a big difference is okay, we need to support our physician pipeline for the next generation with a pipeline for recruitment. So what we have done now is moving forward, I'm doing a huge focus on building the academic mission for BayCare Health System. We have not delved into academics, and right now we are on the run for being one of the fastest growing GME programs in the country, almost with 650 residents who will be graduating by 2029, which means
Awesome.
in 3 years, we went from 24 residents to we'll be looking at 500 plus residents who are approved by ACGME next year, in the next years. So it's a very exciting time for us. I want to say academics is one big piece. Culturally or from a practice pattern perspective, Massachusetts and Northeast is heavily steeped in value based care. And the fee for service mentality is still a little bit present in some of the southern states. So we're moving towards value and taking on more risk. So that's a difference. I do see that the risk taking capability of physicians is definitely ramped up significantly over the past few years, in at least in the region where I am.
That's great to know. And I was noticing, Soumya, that you recently celebrated your 10th anniversary, and
One
yeah,
of our hospitals, one of our
great,
16
great,
hospitals. So
crazy.
it's St. Joseph South celebrated
Yeah.
our 10th anniversary, and that's one of the newer facilities we had built, um, which has been really, growth has been tremendous in that region. But BayCare by itself is 25 years old
Okay,
as a
that's
health system.
that's cool. And
Yeah,
also curious, Soumya, that you are the chief resident physician, chief physician uh,
executive.
executive. So
Yeah.
how does that, what does that mean as in relation to, let's say, a chief information officer, chief medical information officer, or a CTO? So what kind of roles do you play, and where is the overlap or where is the synergy with your other colleagues?
Yeah. So from the chief physician executive role has been evolving through many health systems where traditionally the chief medical officers would lead certain aspects of the health system, such as quality, patient safety, dealing with physician enterprise only in the form of peer review and clinical care. The chief physician executive officer pretty much bridges a little bit more than that. So what it does is it requires us to have a little bit more input into operations, little
I
bit more input into looking at financials and cost accounting and gap, so it's kind of a well-rounded CMO role where you tap into all the other aspects that are required for a health system to be to be very successful, I want to say.
I see.
So we form a very close relationship with every other aspect of our health system, whether it's the technology officer, informatics officer, CMIO, or the chief financial officer, the COO. We form a very close dyadic partnership with almost everybody in the organization. The CMIO and the CIO, so we do have an informatics officer and we do have chief medical informatics officer, work very closely with them because now that there is so much of enhancement in technology input into almost everything we do,
Yeah.
um, especially for doctors too.
Yeah.
With embracing the electronic health record and everything, we cannot do without that kind of partnership.
That's awesome. That was my segue. I was going to ask you that you mentioned new care delivery models and also, about patient engagement and technology now. So how does it all come together for you? What are some of your digital, initiatives that you are thinking about or you're happy about that you have implemented? What are some of the things in the future that you're looking for?
So we have quite a few things. Electronic health record optimization obviously is one of the key areas we want to continue to focus on. We have Cerner as our EMR. So we definitely want to make sure there is always room for improvement and how the clinicians are taking on the EMR positives and the pros and cons within an electronic health record. So optimizing that flow. The second piece that we are working actively on is telehealth, televisits, and telehealth in general. Telehealth and remote patient monitoring is a big focus for us. Just because I already mentioned the population has grown and the access to care has been amplified several fold. So we need more visits to be delivered to this community. The third one is AI, innovation in all forms. So, artificial intelligence, which is the buzzword these days,
Absolutely.
and data driven. A lot of
Yeah.
data driven platforms that we strive to make sure that when we make changes that impact any workflow, that it's backed up and validated by data. So, data driven platforms are very near and dear to us. The other most important one, I think, is the patient engagement.
Yeah.
BayCare is very focused on providing the right care at the right time in the right place. So, we follow that mission to the T, where we want to make sure that patients, providers, so physicians, allied health professionals, as well as nurses, are all taken care of in a similar manner. So patients should have ease of access to care. So all that becomes very critical for us. And so patient engagement tools is another big portion that we are looking at. And of course, interoperability and cybersecurity come hand in hand with everything that we just discussed.
Yeah, yeah. So Swami, you touched on a lot of things. Could you help us, understand more in detail or with any examples that you might have of any digital health initiatives that you found, success in the past with, or that you're moving in the direction of?
So in terms of, just the tools of engagement, we have engaged. So we do a lot of we have done a lot of pilots.
Mm-hmm.
We have done a lot of phased approaches to engaging in digital health platforms.
Mm-hmm.
So let me just share a few of them without mentioning specific names.
Sure.
So, for example, we have engaged in a telehealth platform that improves the care coordination of patients.
I see.
So we are working with a platform right now that actually engages patients, and then they also have the care management or the care coordination support on the back end. So With the tools, first we risk stratify the patients on who is high risk for certain diseases and disease conditions. And then we have the care coordination team actually work with us on identifying the disease conditions. So there
Mhm.
is a patient engagement, there is a chronic disease management component to it, and then there is the engaging the patient through the care coordination team that we have. And then looking at, how the outcomes measure out. So that is one we are actively working on. Then we also have like rehab potential, right? So when a patient has acute hospitalization and they are discharged to home, for example, let's say they have a heart attack. Post heart attack, oftentimes the past would be that cardiac rehab the patient has to come in to the hospital to have the rehab done. Now we are looking at platforms that actually will engage with the patient at home, so they are able to do rehab at home without having to drive around and having to take that long distance time for commute to come in and have the rehab option available to them.
Very
Yeah,
interesting.
the other piece that we are working on is early detection.
Yeah.
So early detection is critical. The speed to detecting certain conditions can actually change the outcome of that patient's condition. So, how quickly do we identify a stroke in a patient? And
Mhm.
is it a stroke mimic or is it a real stroke?
Mhm.
So, we are working with a company that allows us for accurate and early stroke detection. That's one of them.
Very
We
nice.
also have a couple of others where we have an EICU platform where it's an electronic ICU because we need to monitor the ICU in patients, but we cannot have that many intensivists rounding 24/7. So we have an electronic methodology to identify that. We're looking at platforms that look at sepsis bundles, So
Mhm.
there is a whole host of conditions that we are looking at, which are digitally oriented, that allows us to look at them. You said what has gone well and what hasn't. I will share with you that some of the exciting ones are the radiology ones, the
Mhm.
radiology digital analytics, because the radiology ones help to identify, and the accuracy is outstanding. It's like they
Mhm.
have done studies on how many AI driven platforms can actually identify incidental findings
Mhm.
versus a radiologist reading it, or how many radiologists do you need to read X number of films. And so we are looking at platforms that look at incidental findings in the lungs as well as lesions on the heart through echocardiogram. So there's a whole host of digital platforms that allow us to do this. One thing that we have to watch out for is the fatigue that can set
Yeah.
in, alarm fatigue. So sometimes you have these platforms and it's pinging away nonstop because it depends on how you set the platform. If you
Right.
say that you need to alarm me when this happens and you have the metrics not correct, it will be blowing out of control and the alarm fatigue sets in amongst the end user. So I want to say that we have had our mixed bag where we tested a few and we had to give up on a few, and many of them we are moving forward with.
That's great to know, Soumya. So, is there a way that you think about innovation in certain areas, and how about working with startups? Any thoughts or suggestions around those?
So we are very open to the areas of focus are definitely driven by, like I said, the three pronged approach. Is this going to help our patients? Is
Mhm.
this going to help our physicians in any way? Is this going to help our nursing team in any way? We
Mhm.
are working with technology tool that's actually looking at. You probably have heard of this, the doctor's dictations.
Yeah,
It
I'm
used to be
interested.
transcription in the past, and now we are
Yes.
looking at a dictation modality that allows them to just have a conversation with the
Yeah.
patient and not have to worry about the dictation. And there
Yeah.
is AI methodology that works on it. We have
Mhm.
looked at we are working with another company that's doing a similar modality for nursing.
Mhm.
So, nurse voice is being recognized,
Mhm.
so that a nurse can walk into a patient's room and have a conversation and not have to worry
Mhm.
about have I captured everything that the patient told me? So, every
Mhm.
aspect of clinical care is being looked at very closely to see, does it make sense for us to invest in this or not? In terms of, so we definitely look at the feasibility of the patient, the physicians, the nursing. And if it helps improve the way we deliver care, we look at it more closely. The second thing that we do look at, obviously there is going to be all kinds of macroeconomics that jumps into all this with, funding and what is the cost and all that. But we weigh it very carefully. As
Mm.
far as startups go, um, the one thing that BayCare is very open to is if there are programs that are going to deliver on improving care and help our TRIO team, as I mentioned, and they are willing to co-develop a product with us, we are
Yeah,
willing to look at it. So BayCare is not just going to say, well, I'm going to open up my purse strings and just, invest
yeah,
in all this technology, because there is so much out there. So we
right.
want to make it appropriate, available for our team. But at the
Yes,
same time, if people are willing to co-develop, we are willing to
yeah.
look into it.
That's fantastic approach. Yeah.
Mhm.
So as we are getting close to the end of the podcast here and this session here, Soumya, I would like to touch upon the subject of Chat GPT, Gen AI, and all the new things which are coming our way in terms of agentic AI. So any thoughts there or anything that you are kind of heading in the direction of?
I think it's very fascinating.
Yeah.
I'm waiting to see what the next generation of even ChatGPT and Gen AI will do,
Yeah.
because it's mind blowing how data can be aggregated, data can be utilized, and how it can effectively help us. But
Yes.
we also have to be cognizant that, there could be a downside that we have to watch out for. And unless it is fine tuned to the point where we feel comfortable, all of us in the digital world feel comfortable that there is no harm, no threat that's coming out of this, I think we should forge ahead and move forward, because that is the next generation that's going to come our way, whether we like it or not.
Right.
And it's going to be in every industry. Healthcare has traditionally been, I want to say, probably at the bottom of the totem pole, trying to adapt and adopt technology, because we always felt, as a doctor, we always felt, well, technology can never overtake doctors and take care of patients. But when we started understanding how technology can help us drive
Yes.
better patient care, the adoption became easier. So we
True.
have to get to that stage where the chat GPTs of the world have to help us drive better patient care and better outcomes for our patients. Then I think the comfort level will set in.
Absolutely. So, on that beautiful note, Soumya, thank you so much for this interaction. Really enjoyed it. And if you would like to add anything,
I really appreciate this opportunity, and so much appreciate your time too today.
thank
Wonderful.
you, Soumya. Thank you. I'll stop
Mhm.
recording and we can chat for a couple of
Yeah.
minutes. Thank you.
Thanks.